I'm going to welcome everybody now. I know people are going to keep joining. I'm Christine Buckley with the Brain Aneurysm Foundation, and I'm happy to be hosting this webinar, co-hosting it with Rebecca Middleton, who's over in the UK with her organization, Hereditary Brain Aneurysm Support. And this webinar is going to focus on a topic that is definitely very interesting, and I'm happy to know that there is a lot more data being collected on this subject on menopause and brain aneurysms. And we have a couple of people with who are researchers and a physician to speak professionally about this. So we have Diederik, who's professor of neurosurgery and consultant neurosurgeon at the University Hospital of Southampton and chief investigator for the ROAR study. We also have Koji Hosaka, PhD, who's at the University of Florida at Gainesville with the Department of Neurosurgery. And again, this is being recorded. We're going to share it, but I think there's going to be a lot of great information. I want to thank the folks who already submitted some questions prior. That's great. We're going to have that for after some discussion on the topic. Also, feel free to put some questions in the chat as well. We hope to wrap this up in probably like 45, 50 minutes. Because everyone has busy schedules, particularly during this time of year. But again, I want to say a big thank you to Rebecca for all her coordination that she did with this and bringing this topic to my attention. It's great to partner with her again over in the UK. This topic, brain aneurysms are everywhere. They impact all of us in some capacity. And, you know, it's amazing after all the time that they've been around and wreaking so much havoc, there's still so much to be learned and so much knowledge and research to be done in this area. And today, again, we're going to focus on menopause and brain aneurysm. So now it's my pleasure to pass this over to Rebecca Middleton.
Good morning or good evening, depending on where you are. It's lovely to be here, and thank you, Christine, for those words. As Christine mentioned, I'm the CEO of Hereditary Brain Aneurysm Support. We're the UK's first and only brain aneurysm charity, and we're here to support families with familial brain aneurysms and all brain aneurysms. So I founded the charity a couple of years ago, inspired to do something after my own challenging diagnosis and treatment journey. Brain aneurysms, I lost my mum and my grandmother to brain aneurysms, so they have caused devastation in my family. So I have a deep understanding of the impact that they have. And it's great to be here this morning, to shine a light on one of those key topics that, key questions that we have as an aneurysm patient about the menopause, an actual life stage for us. And we know that women have a greater risk of having aneurysm, and we know that that risk increases post-menopause. So we wanted to spend a little bit of time shining a light on that and trying to understand the reasons behind it, and also how we as women and family members and friends of people with aneurysms can help, can protect ourselves, and can find out more and get ourselves empowered when we're talking to our own GPs and our own family doctors. So thank you again for being here today, and thank you to Koji and thank you to Diederik. So I suppose let's crack on. And let's crack on with the key question that, aneurysms are more prevalent in women, in the female line. And why is that? Why is that the case? Diederik, perhaps if we start with you.
Yeah, I guess you have to look at what do we know and for sure and what do we not know. And we just suspect. And what we know for sure is basically exactly what you just told us. Aneurysms are more common in women. And I would actually generalize even further. They're more common as they get older. The suggestion is that there's an inflection at menopause, but even that's not absolutely certain. And there's about 5 mechanisms or so for which we believe aneurysms form in general. And I think pretty much all of them have in some way been implicated as being more common in women. I don't know whether I just quickly mention them, and maybe Koji, who really researches the specific mechanisms, comments on which ones he suspects. But if you work through the sequence, so one mechanism is that there's a belief that the friction between the blood and your blood vessels causes damage to the lining of your blood vessels, and that somehow the way female blood vessels are arranged, there's more friction at certain points, and that predisposes them to getting aneurysms. Then the next theory for getting aneurysms is that thin lining, that there's something fundamentally wrong with it, a specific biochemical substance that regulates how they contract and relax. And that's been implicated as being affected in women. Then there's a mechanism by which people believe that inflammation causes blood vessels to form aneurysms. And that mechanism has been specifically implicated. And I think Koji in particular has had interest in that, leading to aneurysms to form. And then there's the elasticity, the composition of blood vessels, which is believed to also be different in women, and particularly different in women as they get older. So there's all those things that are out there that potentially cause aneurysms, and yeah, we're having to unthread which one is the actual cause. I don't know, what do you have to think about that, Koji?
Yes, our lab's been researching about estrogen deficiency and the inflammation in aneurysm rupture. So we mimic using mice and mimicking the menopause by removing the uterus and ovary and the uterus, and then so we saw some of the upregulation of the cytokine proteins that Diederik mentioned. So that the estrogen deficiency or dropping the level of the estrogen probably causing some sort of the cytokine or inflammation factors, and that's gonna increase the rupture risk of rupture aneurysm. But on the other hand, estrogen also has the protective effect in the vasculature in general. For example, estrogen is going to protect the blood pressure, protecting against the hypertension. So, but the estrogen, we are focusing on estrogen, and the estrogen high and low, they're going to be pros and cons on the estrogens, but the most likely that's the estrogen dropping on the estrogen is going to affect some sort of inflammation. However, that's the question is going to be that's if estrogen is affecting the for the women, especially for after menopause, why men doesn't have estrogens much, the men doesn't have aneurysm like compared to the menopause after menopause. So that's my hypothesis. I haven't done any research. I'm a little interested in to do it, is the dropping estrogen is gonna be it's been protecting the vasculature, but dropping it, that's gonna cause some sort of effect on the aneurysm rupture, so that the man always doesn't have estrogen, so there are no droppage or anything. So that might be the one, not the cause, or the estrogen, dropping the estrogen might be the key for the aneurysm rupture and the formation.
Thank you. And I suppose that takes us on, and we've had lots of questions on this topic as well, about hormone replacement therapy and its role in kind of protecting women because of that estrogen deficiency, and how vulnerable that can make our vascular system. So is there any sort of advice? Is there any advice that has been researched, any tests about the role of HRT in aneurysms, whether you are living with an unruptured aneurysm or whether you are post-rupture? What's the latest thinking and the research around that?
So it's one of those situations where there's a bunch of studies, but they don't come to necessarily agreement. And so some show that the age of your menopause influences your risk of having an aneurysm, but others say the age of menopause doesn't matter. And some say that HRT is protective, and some say that HRT is not protective. My takeaway is that, you know, when there's no evidence, the difference probably is not that big, but we certainly need better studies to try and detect if there's small influences. And the idea behind how estrogens and hormones affect things is that they should be positive. So certainly what actually is probably more often the question I get, which is, you know, is it safe for me to take HRT? Certainly from an aneurysm perspective, it would be on theoretical grounds.
Over to you, Koji.
Yes. So we have done some research on estrogen deficiency and then replacing, giving the estrogen deficiency mice with estradiol. And that protected aneurysm rupture from the aneurysm rupture. So in the mouse and the research side, so estrogen replacement, hormone replacement therapy works well in aneurysm rupture in the mouse model. So that is, I'm sure that works, but the estrogen or hormone replacement therapy might have the different like cons, the bad effect as well, but we haven't done that part of the research in the mouse model yet.
So that as a patient then is you know that there's kind of conflicting research and that conflicting advice then can lead to some worry and some confusion about what's the best way to go forward. Do I go to my doctor and ask for this? Do I go to my specialist and get some further advice? What's the kind of advice that you're giving, Diederik, to your patients when you are faced with people who have got an unruptured aneurysm or post-aneurysm rupture? What's the advice that you can offer in this, you know, in this complex situation?
There's slightly different situations, but the same premise holds, is that I think if you've got good reasons to be on HRT, you should be on it. And I wouldn't necessarily, with the evidence we have, start it purely because you have an aneurysm. It is at this point hypothetical that it helps. And for something that's hypothetically helping, I wouldn't start it for just that reason. But I think the key message is that if you're having symptoms for which you think that HRT would be beneficial, you should, you know, wholeheartedly take, you know, regular medical advice, and if that's appropriate for you, start it.
And Christine, can I just check in with you? Is that kind of the advice that you guys are sort of also hearing, your side of the pond as well? Is it sort of conflicting as well in terms of, do you go for it, do you not go for it? And I suppose it does, as Diederik says, depends on the patient and their circumstances, because no situation is the same.
I agree. I think there is definitely conflicting information because I don't feel that there is enough data to say absolutely one thing or another. And also, like you mentioned too, with every patient, things are different, right? Overall health and age and things like that need to be taken into consideration. So, I mean, that's why I think, again, having this discussion and hearing from Diederik and Koji in two very different locations, and knowing that there is a lot more study and work happening in this area, I think is really important, because we've known for sure that women are at greater risk. We've known at this age, you know, they're at greater risk. So, you know, I've always heard there has to be some correlation, but no one has really nailed that down yet. And I know one of the questions someone submitted, another fact that we know, that African Americans are more at risk for a brain aneurysm. So someone did ask, you know, in this category, does that raise the risk for African American women too in this menopause stage?
Yeah, we know both those facts independently. I'm not aware of any studies specifically looking for African American women, and that combination of risk factors. That the reality is that ethnicity is very understudied actually in aneurysm research more broadly. But there are studies coming that hopefully will address that better. But my assumption is that it's an additive thing. So most of the risk factors for aneurysms, the common ones that we know are aneurysm size, location, blood pressure, these types of things, they're all additive.
And then Rebecca, I was just going to add to it, I think we mentioned it earlier on, but a common question that seems to be coming up is that, you know, when someone is in menopause, are their symptoms of the brain aneurysm different because they are in menopause, or is it exacerbating their menopause symptoms because they have the brain aneurysm?
So are we talking here for people with unruptured aneurysms or after a rupture?
I'd say unruptured primarily is what's being asked.
I think for unruptured, I mean, there's definitely, I've not seen any studies on this, but it's sort of anecdotally, I don't think I notice anything in my patient groups that there's really anything there that it makes it worse. And there's no logical reason that you could think of how a mechanism by which that would happen. There's much more interplay if somebody's had a ruptured aneurysm and a bleed from it. You can quite imagine there being a lot of interplay because of the overlap in symptoms, if nothing else. You know, the fatigue, the brain fog, those are sort of classic, and I haven't said which one I'm describing. It could be either, right? And so when those coincide at similar times, you definitely see people after hemorrhage say, you know, my menopause symptoms were worse. Now, was that because the subarachnoid hemorrhage made the symptoms worse? Or was it just that you got similar symptoms from two different causes adding together? I personally suspect it's the latter, but that's a very real thing.
Thank you, Diederik. And a question that's come in on the chat, and thank you for everybody who's putting their questions in the chat, from Lisa, who's asked about research. So we've discussed that, you know, there are gaps in our knowledge, and we're trying to fill those gaps. But what's ahead? Is there further research looking at clinical trials to look at HRT and aneurysms to get more data? And this is put here, also including biomarkers and genetic testing as well, and looking at the genetic foundation, whether that can help us and guide us to a better understanding. Koji, if we start with you first.
So I am not sure about the, to be honest, on the clinical side of the trial about the hormone replacement therapy. What's the difference in cytokine or expression differences? But in the model, so we start using from mice, smaller animals, and then goes to the larger animal, and then going to the clinical trial in the future. But when we do the estrogen deficiency model, that there is the earlier I mentioned there are significant difference in cytokine expression levels, so that we are in the mouse and we block those, they inhibit those cytokines, and we had a good result by using those antibodies or drugs to lower those cytokines caused by estrogen deficiency. That actually resulted decreasing the aneurysm rupture risk in the mouse model. So, but I'm not sure that it's actually happening in the human, or it's gonna happen in the human, but it's gonna be there in the mice, and then some of the rabbit model and the rat model, the similar thing is happening. So the most likely that, I couldn't say most likely, but they can be happening in the human. So that's the hormone replacement therapy is like the blocking or inhibiting or promoting big, like bunch of stuff. But if we can focus on the one thing or two things, that'll be good, more efficient and maybe less side effect. But that is what I have seen in a mouse model. And also the earlier Christine's part of kind of similar the question and my answer for the aneurysm formation with the estrogen deficiency. So that we use our animal model for the estrogen deficiency, but we didn't see the difference in aneurysm formation in the mouse model. But there is a significant differences in between the aneurysm rupture between estrogen deficiency versus estrogen intact female mice. So just I wanted to add this data.
Thank you, Koji. And Diederik, are you aware of research that is happening, HRT trials, or again, just more of the general research happening of why aneurysms are more prevalent in female lines, and trying to get to the bottom of this, and then answer the question of why that risk goes?
Yeah, I'll sort of pick up from where Koji is and walk up sort of from the more what we call basic sort of studies up to the ultimate question of just a study of HRT. So I guess the next sort of level up is sort of genetic studies in humans, and they're very large international collaborations to look at that, or specifically one, the International Stroke Genetics Consortium has a group specifically looking at aneurysms, and that essentially assimilates all genetic studies across the world. and tries to look through the genetics of people to try and find the cause, and specifically trying to hone in on the female side of that. And yeah, I'm also trying to do one of those contributory studies to get more genetic data from patients. And with the way genotyping is changing, you can look in more and more detail specifically at those areas that you're suspicious of. Kind of more practically, sort of things that make more sense is the next sort of level study up is to look at a large number of patients and see what happens to their aneurysms over a period of time, and see if there's a difference whether they were taking HRT or not. To do that, you need huge numbers of patients, largely because aneurysms don't burst that often. So you have to watch a lot of people for a long time to start to notice a difference if something like HRT, makes a difference. So I'm running a study which really encapsulates almost all patients with aneurysms in the UK. So we've got over 20,000 patients who are being followed up long term. So we have about 5 years of follow-up about to be released. And with that, we can link into all their primary care data in the coming years, hopefully. So we'll be able to see this difference. Do women on HRT do their aneurysms rupture more frequently than those that don't? And I suspect that's going to be that sort of data is going to be the most convincing data we're going to get. The money data that people would want, but it's probably not going to be practical, is to do a study where you give some people HRT and some people don't, what we call a randomized controlled trial, and then see whether the people who have the HRT suffer less aneurysm ruptures. But it's probably impractical to do in terms of the number of patients you would have to recruit into that, how long you would have to follow them up, how long you'd have to keep an eye that they're actually taking their HRT, and all these sort of practical questions. So yeah, I don't think that will happen not anytime soon, at least.
Thank you, Diederik. So we're hearing about the research that has happened. We've heard about research that is coming up, but there is people are putting on the chat that they're still sort of confused about the HRT issue, and I suppose the messages there is to go and speak to your GP, to your primary care doctor as well, to try and get that advice, because it has to be personalised to you. But is there anything that we can do as patients to try and protect ourselves? Is it a matter of just being aware of good vascular health? Is there anything else that we can do to try in this life stage to kind of get through it in a way that we can take proactive steps ourselves?
Overwhelmingly, the two things that we know are what hopefully everybody here knows, which is not to smoke and make sure your blood pressure is controlled. And they're the only two things that are resolutely, proven to make a difference. I'd always, as a clinician, recommend exercise, good diet, and things like that, but they probably have small effects in comparison.
There was just another question that I did want to address. Somebody who had an aneurysm rupture pre-menopause is now approaching menopause and is worried that now, because menopause is coming, would that make her more likely to have another recurrence of an aneurysm?
I mean, without getting into the details of her situation, if you have a single aneurysm and it's treated, the odds of developing another aneurysm are extremely low. So the stats on that are 1 to 3 in 1,000 people who've had a single aneurysm and it's treated will develop another aneurysm. So yeah, I think that's probably the take-home message. You're very unlikely, with or without HRT, with or without menopause, to suffer that situation. So I wouldn't worry too much about specifically the menopause changing that.
Thank you. And then another question that we've had in is, when people have had aneurysms treated, flow diverter, stents, clips, again, is there any other advice that you can give there? Or is the advice, it doesn't matter how you've been treated, or whether you're, whether you don't have, you've not had a rupture, or whether you're post-rupture, is the advice kind of standard? Or is, if you have had a particular treatment, do you have to take particular care?
I don't think I'd alter my advice based on the treatment modality. I think that the thing that, as I say, weighs on me more is if you've had a bleed before. I think the overlap between menopausal symptoms and subarachnoid hemorrhage are is great, and they are difficult symptoms to live with. And we get a lot of people who, for various reasons, have stopped HRT during that period, whether that's because they've been told to, because they just didn't know and they thought it was safer not to. And I think that's a great shame, because I think they would be benefiting all the way through from a symptom perspective from being on it.
And this might
what
touch
about-
upon it too, but I wanted to get someone that's on, it's kind of been waiting patiently, that had been on hormone replacement patches for 6 years, and because of breast cancer came off, has 4 aneurysms, so is a little more concerned, you know, with those aneurysms that are being watched rupturing, because she was on the hormone replacement and now is off. Is that too specific? Or just, I guess it's like the on and off of that, does that play a role?
It's obviously a very specific scenario. Often in medicine, we're making decisions between, different things that are going and pushing you in different directions, and sort of you work on what we say balance of probability, and what's the bigger drive. And I'd say in that situation where you've had breast cancer, the bigger drive for me would be to do the right thing for that. And I suspect the effect on any aneurysms would be much smaller.
Thank you, Diederik. And another question that has come in about aspirin and the effect that this might have on estrogen. And do you have a take on this? Is there a line, is there any further research on HRT and daily aspirin? Is there any correlation there? Because I know a lot of patients, brain aneurysm patients, are on baby aspirin. Is there any kind of anything to add there on that?
So I'd ask Koji, because there's some pretty complicated research about the interplay between aspirin, inflammation, and
Yeah.
being female,
Yes.
that I struggle with, to be quite honest. And then I'll give you the general perspective on aspirin.
Yes, so that is the aspirin. It's being researched in the animal model for the aneurysm model, and the aspirin actually reduces the aneurysm rupture risk and the formation as well. But I haven't seen any correlation, like any studies using estrogen deficiency and the aspirin together. But the aspirin is gonna reduce the risk of aneurysm rupture, but the aspirin also, because of the aspirin, is gonna decrease some of the inflammatory factors. So that is why the aneurysm rupture risk is gonna be decreased. But there is gonna be, I cannot tell the exact what's gonna happen with HRT and the aspirin together. So that I cannot tell you exactly, but the aspirin, data shows that decreases aneurysm formation and rupture in animal model.
So yeah, so clinically, in a nutshell, that's there's the idea is that aneurysms form because there's inflammation in a blood vessel. Aspirin reduces inflammation, and therefore the theory is that aspirin is going to reduce rupture, which works in animal models. In humans, there's evidence, again, a little bit mixed. It's not fully proven. There is evidence that women are more sensitive to it. And this is one area where there is a randomized controlled trial being conducted at the moment, in predominantly out of Holland and Germany, but across the world, that hopefully one day will provide a definitive answer whether we should take aspirin if we're on have an aneurysm or not.
One thing I would like to add, so our aneurysm research in using animals, most of the aneurysms being induced in the animal by using chemicals. So that is completely different from the human, like patient who developed the aneurysm or getting ruptured. So that if we see, for example, aspirin, it's gonna protect aneurysm rupture, doesn't translate directly into the human trial or anything. That's why we need to do mouse. We saw those effect in the mice, and then goes to the larger animal, and then goes to the human clinical trials. Just I wanted to add those information.
Thank you, Koji. A couple more sort of questions from my side, questions that have come in, and questions that are on the chat as well. we have one of our guests, Pamela, has said that she's had 2 aneurysms, ruptures successfully coiled at the age of 42 and experiencing perimenopause symptoms, and she has an unruptured aneurysm. Again, is there any studies that show going through perimenopause, going through menopause, if you have had a rupture and now you're sitting with an aneurysm, that risk may increase, or is there any data there that we can share?
Through the scenario, I mean, data is the same as the general data that, you know, as you get older as a woman, your risk increases, and that will be increasing for her just the same, I guess.
Okay, and then what about the familial side as well? You know, coming from Hereditary Brain Aneurysm Support Charity in the UK, that's a question that we get a lot, is, you know, brain aneurysms run through my family, so the risks are perhaps different there for our community. But what about if you have a strong family history and you are experiencing perimenopause or menopause symptoms? Again, is there any research there, anything that we can share in terms of those risks, or anything that we can do to protect ourselves in that situation?
So I think the bits that we do know is that hereditary aneurysms are particularly an issue for women. So essentially everything we've talked about today, I would imagine, is particularly the case for familial aneurysms. But there's no additional data, so there's no specific studies, just because familial aneurysms are, you know, a subset. So you're just looking at a smaller and smaller group each time. So I'm not familiar with anybody looking specifically at menopause in familial aneurysms. I see Koji nodding.
Yeah, I've never seen those the data, but the genetic disorders such as Marfan syndrome, so the patient has more rupture, aneurysm formation and rupture, but so that doesn't connect with, I don't think they're gonna connect with estrogen deficiency or menopause in the future. So I am not sure much about the data, those on genetics and the menopause and the aneurysm formation or rupture.
Had another question too. You know, we're talking a lot about the data being collected and the research that's going on. And I know there isn't a lot being done here stateside, you know, with physician education. Is there much being done anywhere? I mean, to make primary care folks more knowledgeable or understand the prevalence of brain aneurysms, you know, in this part of the population. I know over here, we do work with an organization that gives accreditation for primary care docs and things about the detection and management of brain aneurysms, but I don't think it highlights that this population or just the impact menopause might have. And it's making me think it's something maybe that we have to help raise the awareness and education on this, just because it's such a primary, you know, pocket of people who are impacted by this disease. So Diederik or Rebecca, is there much education and awareness of the medical community for this where you are?
Well, in some ways, I'd say, you know, I'm here part of the education. That is the purpose. I realize this is more patient-facing, but it's the work of Brain Aneurysm Foundation and HBA Support and organizations like yourselves that are getting that message across. In terms of practical education within medical schools and getting messages across, say, across primary care, the issue is you need to have a hard message to be able to educate with. And as you've heard what we've talked here, I can tell you with confidence you shouldn't smoke and you can treat your blood pressure well. But there's a lot of things where there's not clear agreement amongst the experts. And then it becomes very hard to give a very clear message.
Inbox is full of kind of questions, not just on HRT, but other kind of questions about how do I speak to my GP, how do I speak to my primary care doctor about this. And you know, one of the things that we are very interested in doing and we're committed to doing is empowering the patient to have those questions with their GPs, because the education isn't there, the awareness isn't there. So it then falls on the patient to actually educate the GP and educate the doctor. And then you can move forward and then hopefully link up to the neuro services and the neuro teams, such as the one in Southampton, which Diederik leads, and then you can get the care and that personalised care that you need. But yeah, there are massive gaps, and we are looking at the best way of trying to fill them. But first stop is we start with the patient, because they have such a powerful role to play in advocating for themselves and advocating for their care.
Perhaps I should give a slightly clearer message that, although I'm vague that we don't know whether HRT makes a difference to aneurysms or not, I'm reasonably clear that I wouldn't start or stop HRT around an aneurysm. I would do what's right for that patient and the symptoms they have. And primary care physicians are in perfect position to judge that and help with that. They just need to help to know that, not to be wondering, is it safe to give this or is it not safe to give this?
Yeah, and I suppose that's thinking of the time that we've got ahead of us and the time that is fast running out. What is the kind of that key message? We've talked about aneurysms, we've talked about HRT, we've talked about the increased risk in females and down the female lines as well for the familial side. Is there any kind of takeaway messages that you can give? Because obviously there's a lot of, the research just isn't there yet. We've come so far, there's so many gaps we need to fill there, but what's that kind of takeaway advice that you would like to kind of give to our communities either side of the pond?
I think I just gave it personally. It's, if you've got symptoms of menopause and you feel that you benefit from HRT, don't be scared to take it and don't let your aneurysm influence that decision too much.
And Koji, any final thoughts from you?
Yes, that's I agree with Diederik, said to follow what your physician recommend, and we're gonna continue doing all the animal research and then find the best way to treat for the future. So if all the patient keep educated by themselves using your website or Brain Aneurysm Foundation website, they're gonna be a lot of information. So, and then you can ask questions, but if the physician said, your doctor said, so I would just follow what your doctor said.
And I guess as a final sort of takeaway for the future, hopefully in a couple of years' time, we'll have finished the ROAR study and we'll come back with some harder answers.
No, I think the encouraging thing is the research is being done, right? And everyone here that got on, a lot of people signed up for this and waiting for the recording, but I think like Rebecca said, the key is empowering the patient right now to have the most knowledge that they can have, and to, speak to your physicians, never be afraid to ask questions. I mean, it's your health, you have to take care of it and advocate for yourself in the best way that you can. And hopefully webinars like this will continue to give you more and more information on certain subjects. But I know I definitely feel great knowing that Diederik and Koji are working behind the scenes on this and trying to get us some good data that will strengthen, your arguments, or just, give you a really solid basis for when you're asking for something or questioning something, that you have something to refer to. So I want to just say thank you to Koji and Diederik very much for sharing with us and your time, and for the work that you are doing to make things better down the road for other patients and family members, because it means a lot. And I know people do get scared and they wonder, and when there isn't something that you can refer to back you up or to completely answer your questions, that's really hard. Aneurysms are scary enough, and then you throw in these other, subject matters or other, health issues or times in different people's lives. It is difficult and it is hard. And so I just want to say again, for everyone that's been through it, I mean, Rebecca as well, in how you are giving back, a huge thank you. And I just do feel positive that there will be more results down the road and we'll get more information. And again, things will be better in the future. So thank you. And thanks, Rebecca, again, for bringing this all together. I appreciate it.